Hip labral tears are a common yet often misunderstood condition. As physiotherapists, we frequently encounter patients who are misinformed about the diagnosis and treatment option. That's why I'm tackling 5 major misconceptions about hip labral tears. Myth number 1. If you have a labral tear, you'll always have pain. Surprisingly, many patients with labral tear are asymptomatic. This is very similar to the rest of the body. Like we see, rotator cuff pathologies, we see low back things like disc herniation. So it's similar with the hip. So in about 50 to 60% of cases, this could be purely an incidental finding on the MRI. So having a report of a labral tear on the MRI finding doesn't necessarily mean that it is the source or that it could cause pain. And that leads to the second point, that hip labral tears are the primary cause of hip pain. And we know that hip pain is extremely complex. It could be caused from intra-articular pathologies such as hip impingement, OA, or hip dysplasia, and also extra-articular pathology, which could be coming from the muscles and the soft tissue around it, or it could be referred pain, or it could be even be non-MSK. This is where a thorough assessment is crucial to make sure that we know that which is the key structure, the pain driver for the symptoms, and it might not be linked with their labral tear which has been reported on the MRI. And the third misconception here is only hip labral tears only happen to athletes. While common in sports, labral tear affects both active and sedentary individuals. So structural abnormalities like cam morphology, aging, and repetitive stress like jobs where they're doing a lot of physical strain can also contribute to this normal age-related degenerative process, which can lead to labral pathology. Myth number 4, that you can't stay active with the labral tear. We know rest is not always the answer. With proper activity modification rehab, patients, including athletes, can manage the symptoms and maintain an active lifestyle. So definitely movement is medicine for these cases, and with the right rehab approach, we can pretty much get them back to the activity levels which they desire. And the final point is, it's natural that patient might think that you need a physical solution where they need the surgery is the only treatment option. And in a small group of patients, surgery might be necessary, but most cases can be managed quite effectively through a combination of physical therapy, activity modification, and sometimes there is definitely a role of intra-articular injections, especially when the irritability is high. So it's sort of making sure that the patient is aware of all the options and that surgery is not the only path for these cases. So some key take-home points here is, in many cases, it could be purely an incidental finding, and it might not be even the source of pain. It could be something which is not related to the patient presentation, and not every labral tear needs surgery. A comprehensive evidence-based approach is really necessary to a more personalized treatment.